So I'm Jon Swanson, and it's my wife Kay, and she and I have been partners in a long journey that's included an Air Force career and the transition to MEMS after that. Well, I did have a long career in the Air Force, and one that I really enjoyed. I was able to fulfill a childhood dream to fly airplanes, and as well as some special assignments along the way that in many respects, both directly and indirectly, I think helped prepare the time at MEMS. Because really, it's all about a mission and the people who have to fulfill that mission. I was looking for something that had some real substance to it, that would make a difference potentially, and to be part of something much bigger than me. And so we found out about the opportunity at MEMS they had a vacancy for an EMS director. And I told Kay that, hey, this is what I think I want to do. And she laughed and said, you can't spell EMS. They're not going to talk to you. But they did.
When Jon started with MEMS, it was a good EMS system. However, Jon has taken it under his leadership from a good EMS system to a system that legitimately can be described as one of the top in the nation. He has built or helped build programs that have served Arkansans far more than anybody really truly understands that isn't in the industry.
He's very knowledgeable, he's curious, he's very ambitious, he's very busy, and his bridge game needs improvement. He needs a lot of practice.
I think one thing about Jon, you weren't going to outwork him. And when it came time when he moved in as the executive director, one of the first things he did was go to school to be an EMT, to figure out really what the work was, what the job was.
He wanted to get the feel of the work that people were doing, and also appreciate and understand the nature of EMS in Central Arkansas, what people experience when they call an ambulance.
One of the early experiences that I had, and it made a huge impact on me, I was responding to a call to a young infant, maybe 6 weeks old. And I walked as a total stranger into this woman's world, into her home, and she hands me her 6-week-old baby, believing that the child is dying, and in fact, the child was. And looking in her eyes and realizing what it meant for her to be able to give that child over to a total stranger. Please help me. Please help my child. And I have never forgotten that experience. To tell it now is to give me some chills up my back, because of the impact of that and the appreciation of what that represented, to me, motivated everything about what followed was in the quality of the training, making sure the equipment and the protocols and all of the tools that the medics need is available to them.
He was the kind of leader that led by example while also showing you that he cared about the people that worked for him.
Jon could be tough, and he could push you, which is the sign of a good leader, but he also very clearly supported you and was there to listen to you when you had ideas that you thought needed to be brought forward.
I've had the opportunity to work with Jon over the last 2 decades on a number of events, some predictable, some not. The first was in the Little Rock Airport hangar, where we triaged over 1,000 evacuees from Hurricane Rita and Katrina.
When he first hired me, he said to me that he would like to diversify the staff here at MEMS. He wanted MEMS to reflect the community that it serves. And that was important to me too, because it builds trust in the community when you see those that look like you show up in your emergency need. And he was very determined to make that happen, and it happened.
I think some of the major accomplishments that Jon had in his tenure there were our education program. In the past, we'd have to wait on people to go out and find an EMT school and spend their own dime and then go look for a job. By creating our own education program, we were able to hire people from the very beginning, pay them to go to school, and in fact, our program, the way it works, is you're earning college credit at the same time.
When we began to develop the trauma system in the state, Jon saw a role for MEMS and approached the health department and was able to negotiate a relationship with the health department so that trauma communications flows through the MEMS dispatch center. So in reality, there are 2 dispatch centers in MEMS, one for regular emergency calls and non-emergency calls, and then there's a trauma communication center that's side by side. And they coordinate all the trauma activity to get the trauma patient to the right level of care as soon as possible. And they have dramatically reduced the time it takes to get a trauma patient into the right level trauma center, and they facilitate the admission, they facilitate the transfer, and have made a big difference.
And in the course of TraumaCom, the preventable traumatic death in Arkansas has dropped from 16% to 4%. And then when COVID came along, it was an easy, almost automatic transition. The governor referred to it as COVIDCom.
Personally, for Jon, it's been a humbling experience and a great, great honor to work for the men and women of MEMS. For him professionally, it's the culmination of parallel careers in public service, first in the Air Force for 28 years, and then serving the men and women of MEMS for 23.
There's probably not a place in this state that you can go where his impact is not felt. His professionalism in building the brightest and the best that work in emergency services, he has touched a lot of lives.
No one at MEMS worked for me. I work for them. They're there to help people. And I am so proud to have been part of an organization of men and women who are so committed and dedicated to what they do. It's an amazing place and amazing people.
I worked for Tom Bruce in 1976 and 77 when he was dean at the College of Medicine. And Jon Swanson embodies all the strengths and the insight and intellect that Tom Bruce displayed.
Jon, congratulations. On behalf of our ACHI Health Policy Board, I'm honored to present to you the 2022 Dr. Tom Bruce Arkansas Health Impact Award.